Yeah, this is the center, and this is where it's situated in Hyderabad. This is the area is called Bashir Bagh, and these are some of the things. This is the general reception, and this is how it looks. And if you can always focus on some of the things as such, and this is the clinical mental toxicology. This one certification, and there are a lot of other accolades of Dr. Saxena, and these are the few of the things which appeared in the press and other articles, and why we have such poor health. Why do we have such poor health? This was one of the best appreciated kind of stuff, and this is the patient's reception area, and coming back. See, yeah, and this is one of the front office peoples, and here we are trying to work out on some of the modalities. I'd like to show you what are the other modalities which we are doing, and this is one of the chambers wherein we are doing something called PPK therapy with these people, and apart from that, and this is what. Yeah, this is what is called ECP. ECP is an external counterpulsation device wherein the patient patient lies down on this couch, and in a sequential kind of you start giving the pressure to the calf as well as the thighs as such in a sequential manner, and the computer times everything, and increase of pressures which occur during the phases of diastole in the heart, which is the one which helps it as such, and this is the compressor, and these are some of the oxygen therapies what we are doing with this hyperbarics here, and apart from that we have something called Cryo Lipo laser. I will just introduce this particular thing, and this is one of the laser therapies which are being tutored as helping out obesity. Obesity is a curse now, and particularly people doing a lot of weight loss with some kind of dieting and all that. But I can always tell you the redundant weight loss which happens only with this kind of cryo lipo, as well as we try to work with another modality which is called as laser, and working at the laser level things becomes perfect. This is the area where we are giving intravenous vitamin C, glutathione, and intravenous chelation therapy. Here we are trying to give with all this kind of infusion pumps. This is one more, and the patient stays here for not less than an hour or something like that, and he's being given this kind of, yeah, this is what is the thing called hyperbaric oxygen therapy, and I can always focus you this particular stuff where we are able to show the kind of see the oxygen diffusion into the normal water, and during the hyperbaric the oxygen molecules become smaller and under hyper pressure therefore more soluble. Smaller size allows oxygen to dissolve into all the body fluids like the plasma, cerebrospinal fluid, interstitial lymphatics, and synovial fluids. So effectively the oxygen goes to the remotest part, and here how it works, the way it works in the normal all CVAs as well as autism and cerebral palsy, and we are trying to work on this particular module. There are as a medical doctor we used to think of there are only one is dead cell, another is a normal cell. Now we are able to see in the areas of infarction, and in the area of penumbra and umbra along the infarction, you will have some sleeping brain cells which we called it as a idling neurons, and just with the force of hyperbaric oxygen, this suddenly there is a it is a restart mechanism which starts working. Absolutely, there are a lot of other methodologies also, And this is again to show you how this hyperbaric is helping out throughout the body. And see, in this picture what is being shown is it's the circulatory system is in the red, and you have got a lymphatic system which is in the green, and thing as such. And normally it's lymphatics doesn't take care of carry oxygen at all, but with this hyperbaric pressures we are able to use the lymphatics also, and with that oxygen goes into the lymph fluid also. That makes a lot of difference. It makes a lot of things as such. This is how it lymph vessel starts carrying oxygen, and when the lymph starts moving, and when the lymph starts working out, and it makes a lymphatic sluggishness is the major cause. I was talking about this technology called Cryo laser, wherein we are trying to show this is a fat layer during this process and afterwards. You can see there is a decrease in the kind of yellow part which is there before, and this is the yellow part as such. So the thing is, with the laser what happens is that you have got adipocytes at rest. Adipocytes are being bombarded with the same kind of laser kind of things, and there are microporations actually which happen. With the microporations you start this is the way the the size automatically comes from this globular thing, it comes down to this one. So yes, these are the few of the things we are trying to work it out. We are somewhere our concept is this: we must change always, renew, rejuvenate, otherwise we harden. And taking cue of some other things what we have been developed over some period of time. And we have this kind of chambers which is called far infrared chambers, and here the patient is made to sit inside the chamber, and he starts sweating out things properly. And along with that we have something like oxygen ozone chambers also. This is ozone steam chamber. This is called the Sauna Chamber, and we have developed a lot of protocols particularly for diabetics as well as heart disease patients and all that. And yes, this is what our center looks like, and this is we are just trying to do some kind of slightly out of box thinking. And I thank you all for giving the